गुड इवनिंग, नमस्कार सभी को। आज के इस सेशन में आप सभी का बहुत बहुत स्वागत है। वार्म वेलकम एंड ग्रीटिंग्स टू ऑल ऑफ यू फ्रॉम आयुष दर्पण फाउंडेशन, देहरादून, उत्तराखंड। आज के इस सेशन में हमारे साथ है डॉक्टर भारती कुमार मंगलम। सो आई वेलकम यू मैडम। टुडे वी आर गोइंग टू हैव अ सेशन इन द मेमोरी ऑफ लेट मिसेस वैद्या प्रेमवती तिवारी जी। दिस इज अवर ऑलमोस्ट 8th सेशन। पिछले महीने से हम लोग इस प्रेमवती तिवारी लेक्चर सीरीज को यहाँ पर आपके सामने प्रस्तुत कर रहे हैं। तो आप सभी का इस मंच पर बहुत बहुत स्वागत है। और इस सेशन का आरंभ हम धन्वंतरी की वंदना से करते हैं। सो आई एम जस्ट शेयरिंग द धन्वंतरी वंदना।
शंखं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनम् मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्।
Once again, welcome, Madam Dr. Bharti Kumar Mangalam. It's a great pleasure to have you, Madam. Such a nice personality in the field of Prasuti Tantra and Stri Roga, a well-known name. Dr. Bharti Kumar Mangalam, she is a professor and head in the Department of Prasuti Tantra and Stri Roga in National Institute of Ayurveda, deemed to be University, Jaipur. So, welcome, ma'am. Welcome on this platform of Ayush Darpan. And I'm very much excited to hear you, and all our doctors are also excited to listen to you, ma'am. Please start your session. And today's topic is Uttar Basti. I think Uttar Basti is the most hit topic in the field of gynecology. And yes, ma'am, please, you can start.
Thank you. Thank you, madam.
Yes,
first
ma'am,
of all,
yes, ma'am, please.
मैडम ये शेयरिंग ट्राई कर रही हूँ।
Yeah, okay, yes. So welcome all the doctors who are present here.
Madam, is my screen visible?
Yes. You can just maximize it.
Okay, screen sharing में डाल देते हैं।
Yeah, now it's okay. Yes,
is it visible?
Yes.
Okay,
Please
okay.
continue.
Yeah. Thank you, madam, for giving me this opportunity to share my whatever knowledge I have on the Uttarasi and its practical aspects in different diseases and its future scope. आगे मतलब भविष्य में इसका स्कोप क्या है, वो तो एक तो हम संहिता में पढ़ते हैं, और आगे भी जो कंडीशंस अरेज हो रहे हैं आजकल की जमाने में, तो उसमें भी उत्तरवस्ती कैसे काम करेगा। तो एक दिस अ प्रेजेंटेशन एज अ पार्ट ऑफ माय paying homage to my beloved and most respected, the legendary professor, Professor Premavati Tiwari, who was my guide in Banaras Hindu University, जिनसे अकेले मेरा गाइड नहीं है, वो पूरी दुनिया के लिए प्रसूति जो भी पढ़ते हैं उन सब के लिए गाइड है, हमारी मैडम है। and the one and only person who dedicated her life, her entire life for the service of female. मतलब फीमेल की जो जितना पेशेंट्स है और उनके नाम से जो आते थे और आखिरी दम तक उन्होंने उन्हीं की मतलब सेवा में अपना जन्म को चरितार्थ कर दिया। तो इतना ग्रेट लेजेंडरी प्रोफेसर की इस स्मृति सीरीज में भाग लेने के लिए मैं बहुत हूँ, मतलब आई एम वेरी मच प्रिविलेज्ड to take part in this series of presentation. So and today's topic is the Uttarasi, the practical aspects. So before entering into the Uttarasi जो classical description है, तो let me give some background how Uttarasi is going to work there. So the background is, first of all, हमारी पूरा domain है आर्तव है, तो entire menstruation, it's normal and abnormal scenarios, both are coming under this. तो आपकी जो उत्तरावस्थी, हमारी जो उत्तरावस्थी, जो हम सबका उत्तरावस्थी है, that is going to work on the this menstrual cycle, the functional aspects of the menstrual cycle. Of course, the Adhisthana is the endometrium or the vaginal canal. So it is essential to learn about these the normal scenarios and abnormal scenarios of the menstruation. And if at all we want to produce any novel acceptable medical treatment for gynecological disorders, then we must have knowledge about it. So increase in knowledge of this endometrial physiology will have many translational applications at other tissue sites also. इसका मतलब भी है, आगे मैं समझा दूंगी what are the translational applications at other tissue sites. By governing the endometrium, how we can go for the other translational applications. And human menstruation occurs as a consequence of, you know very well all, I have seen my juniors, my seniors and my beloved friends on this platform joined for this presentation. So the pre-implantation decidulation, if failure is there, then menstruation onset is taking place there. And our main motto is we want to support these phases of pre-implantation decidulation and conferring embryo selectivity and ability to adapt and to optimize function. So in olden days, women used to have around 40 menstrual bleeds only due to the multiple pregnancies and long lactational amenorrhea. So somehow she was protected. So short, the active menstrual cycles were there, so she was protected. But nowadays, in contrast, more number of menstrual cycles, so she's undergoing that, the physiology of the physiological changes of this many number of menstrual cycles, and thus that is a in fact occurs on the woman. So in modern era, due to advancements of family planning and changing outlook of means the more number of the people educated and they want to limit their family size because of the economic burden or the burden and the nuclear families nowadays. So women in developed countries now can expect greater than 400 episodes of menstruation in their lifetime. So in comparison to the previous times, now the woman needs more of Uttarasi episodes. Like the seasonal regimen, whatever mentioned in Ayurveda, so women also should undergo the periodically the Uttarasi. I mean to say that because she is now more at risk because she is having expect to have greater than or more than 400 episodes of menstruation. So there is more susceptibility of women to suffer the functional reproductive disorders. So whatever Ashrukdara, Arthavudushti, n number we can count, including the cancers. So I was telling the translational application of the menstrual physiology, the new methods. So what is the translational here? So in this cycle, almost मैं बहुत सारे मेरे presentation में ये incorporate करती हूँ कि how the repair is relevant to other translational applications of menstrual physiology. You can see this blue circle. This one is I have taken from Mabin et al. From the PubMed. So here you can see the we all know that endometrium, 2 layers, functional and basal layer of the endometrium. So the functional layer is shedding off during the menstruation, dots you can see, and repair is taking place consequently at the basal layer. So what you can understand with this is the stem cells are present in the basal layer of the endometrium. So when you are applying certain aspects, including the Rajaswala Panchkarma, you are helping properly from the, these cells have the capacity to generate other cells also. Okay, so totipotency is. So here, when we are properly dealing with the menstrual and Rutumati Charya, I believe we can avoid heavy menstrual bleeding, dysmenorrhea, etc. And of course, translational applications I was talking. So other kind of inflammatory disorders also we can prevent, because these stem cells, if you are dealing properly with the Rajaswala Charya and Rutumati, so that is going to help in combating the different diseases that are occurring at different parts of the body. So that is the translation application of the menstrual physiology. And these stem cells are in fact future therapeutic potential with reference to the gynecology. I'm not talking about other systems of medicine, I mean other branches of medicine. Here stem cells in endometrium and future therapeutic potential only we are going to deal with. So uterine stem cells and their future therapeutic potential in regenerative medicine is giving a big hope to utilize. So okay, we are not going to take the stem cell therapy, but without the stem cell therapy, through the Uttarasi, you are going to help how the stem cells are helping directly in the regeneration of other tissues. So through the Uttarasi, you can support other diseases also. Recent studies have identified the presence of multipotent stem cell populations in the endometrium. So these are termed as the ENSC, endometrial stem cells. So are readily available source of regenerating cells that comprise a population of epithelial stem cells, इसमें mesenchymal है, side population stem cells and endometrial regenerative cells. So there are different stem cells present in the basal layer of the endometrium, so that has got the capacity to support any other kind of tissue regeneration also. So now I believe you understand the importance of the Uttarasi. So stem cells in endometrium, therapeutic application of these stem cells has been promising in several diseases and degenerative conditions such as myocardial infarction, stroke, etc. So these are the translation applications of the stem cells, stimulation of the stem cells in the endometrium. So their role is also explored in tissue engineering applications. That is other part of the story. We are not going to deal with that. So endometrial stem cells has been linked to the pathogenesis of several gynecological conditions such as endometriosis, hyperplasia, cancer, and the adenomyosis. So you can see here the stem cells present in the basal layer of the endometrium, and those are coming for the rescue whenever the infection or the injury is there to replace the normal tissue. So we have to, there is a need, we have to maintain this. And the other part of the story related with the second heroine is the Apanavayu, that is regulating the ovarian steroid functions. Whatever the neurological or neurochemical messengers are there, how they are communicating, all the functions of these neurochemical mediators and messengers comes under the Apanavayu, that regulating the ovarian steroid function. So this is another story. This regulation also you are doing with the Uttarasi. I'm not going into many details. I don't know much about the time limit what I have got, but I'm not going into the minute details of this Apanavayu, how it is regulating the ovarian steroid functions. So Apanavata regulating even the proliferation through the steroidal functions. It is regulating the endometrial proliferation, ovulation, I mean including the maturation of the primaries to secondary oocyte and the formation of the ovum and release of the ovum. So all these are regulated by these Apanavayu, right? So that is a background showing this slides. So coming to the endometrium, is a fascinating dynamic steroid responsive tissue that undergoes repeat cycles involving sequential proliferation, differentiation, breakdown, and repair. So these changes are regulated in the presence of estradiol and progesterone. The sole purpose is to enable the implantation of an embryo during a relatively short window of opportunity in the menstrual cycle. So, so again, in infertility also, Uttarasi is important, right? So not only the stem cell and repair of the endometrium, even for the enhancement or to enhance the support of the implantation window at the level of the endometrium, Uttarasi is helpful. So coming to this, everybody knows that Uttarasi is called Uttarasi because that is the Shrestha they are giving in the Uttar Marga. So the media, Sneha and Vasti. In the Sneha also we use majority of the times Thaila and Gruta. So it's a promising treatment in all gynecological disorders, right? So it may be the uterus, tubes, vagina or the ovary. So general indications given in the classics you can see here: Vasijeshu, Vikareshu, Yoni Vibramshideshu, Yoni Suleshu, Tivreshu, Yoni Vapat, Ashugdara. मतलब जो जितने सारे गैनिक का है आप इसमें देख सकें. तो थोड़ा बहुत जो अटके है वो मूत्र मार्ग की उत्तरस्थ की बात है. मूत्राघातन, मूत्र दोषान, मतलब उसकी भी. और you can see प्रवृद्ध योनि व्याधि, ऐसे जो क्रॉनिक और एग्रेसिव कंडीशंस है आप उसमें भी उत्तरवस्थी कर सकते हैं. So in a nutshell, these are the indications: Vasti Vikara, Yoni Vikara, Garbhashaya, Ashrugdara, with functional disorders also covered under indications. Yoni Brahmsha, so and Vandetva, Shula, Vata Yoni Vyapat. So many indications are there in the classics. We can see direct indications are there in cases of the Yoni Vedana, Yoni Karkashata, Putragni, all these conditions. So the types of Uttarasti, Mutra Marga and Yoni Marga, we all know that based on the material used, Snehika Uttarasti, Niruha Uttarasti, and based on the purpose, Shamana Uttarasti and Shodhana Uttarasti. So this is the classification of Uttarasti. And one more thing is the Arohana Uttarasti. So when you are increasing the dose, Arohana Uttarasti is mentioned in the Ashtanga. So when you are increasing the dose, so it's called as the Arohana Karma Uttarasti. So one Karsha, then followed by Ardha Karsha, like that you can enhance based on the indication and the necessity. So, and Garbhashaya Snehana Shodhana, where we need Shodhana, where we need Snehana. So stimulation of stem cells in the basal layer of endometrium promotes regeneration of optimal function of endometrium. So there, in such conditions, if you want this proper to done, then Snehana Uttarasti you can do. That is intrauterine installation of oil Snehana, mainly to achieve Garbha, that is achieve conception in cases of the infertility, particularly in endometrial factors. And in case of the Yoni Brahmsha, so we have to give the Thaila Uttarasti. Niruha Uttarasti is not very much useful there. So, okay, what is the dose indicated? That's a different issue, or that is about the Mutra Marga Uttarasti. And Garbhashaya Shodhana, so mainly to cure the disease, Shodhana Uttarasti. We know that Shodhana is, we want to evacuate the morbid doshas from the Artavaha Srutas. So there Artavasti Ashrugdara, sorry, Artavdushti Ashrugdara, Artavanasa, Artavakshaya, Yonisula, etc. All these pathological conditions comes under the indications of the Shodhana Uttarvasti of Garbhashaya. So Garbha Marga Sneha, regeneration of endometrium, how it is taking place, and the experimental study also done on the female mice. And of course, this study done by the modern people for some other purpose. So thin or damaged endometrium causes the uterine factor derived infertility, is resulting in failure of the embryo implantation. So regeneration of endometrium is a major issue in gynecology and reproductive medicine. So they are carrying out these kind of studies. So 3 to 10 week old female mice को ले लिया, anesthetized using the isoflurane. Chemical and mechanical methods using ethanol at different concentrations and copper scraper were compared. So damage of uterine tissue was induced either by vaginal or the dorsal surgical approach, and after 7 to 10 days, gross and microscopic morphology, safety and efficiency were compared. So इसमें result में ये देखा गया था, both chemical and mechanical methods resulted in thinner endometrium and reduced the number of glands. तो इसमें ये साबित करना चाह रही हूँ मैं कि this is the opposite side of the story, the opposite side of the other side of the coin. But the front side of the coin, what I wish to tell here is the, when you are giving the Snehana, the endometrial proliferation, you are assuring. So, right, with this study we can understand that Snehana Uttarvasti will help in the regeneration of endometrium at appropriate level. and of course the number of glands also can be enhanced there. So that's what we can do in cases of the infertility. So these are the pictures how damage took place and the thinning of less number of glands were seen after the in uterine hearts of the mouse of the this uterus of the mouse. So, and next is the embryo implantation. The success of embryo implantation is related to the blastocyst quality as well as to the endometrium receptivity. Both the embryo and the maternal tissues are able to reciprocally exchange the signals. There is a dialogue happening between the maternal tissues and embryo. So when you are doing this Uttarasi, you are enabling this dialogue, exchange of the signals between the maternal tissues and the embryo. So probably this is setting right the signals part of the amsha, that is the part related to the apana vayu, to exchange both with the blastocyst through the stimulation of the endometrium. So several mediators are there in that involve growth factors, cytokines, so many. We are not bothering about all these chemical messengers causing the exchange of dialogue between the maternal tissues and embryo. But what we have to understand is we are through the Uttarasi, we are enabling the dialogue between these two. So probably these array tests and all we can carry out in cases of the Vamini Yoni Vapor. And epithelial mesenchymal transition. So another very important characteristic for endometrial receptivity is the another test. This is the EMT. So this is again a supporting point how we can enhance the endometrial receptivity through the Uttarasi. That's all. Time of administration of Uttarasi should be given during the Artavakala because Apavruta Yoni means this is devoid of the coverings there. So what do you mean by coverings here? These are the functional coverings. You don't see that something like the membrane. Kala Avrita is not there. So in Samhita, these functional aspects are more dealt. So like the Apavruta or Avrita, etc. So Apavruteti Apagata Sanchita Rajarupa Rakta Avarana means the Purana Rajas is expelled out. So अपगत संचिता जो पुराने इसमें संचित हुआ था उस रजरूप आवरण से अपावृत हो गया, बस कहने का ये तात्पर्य है. So we can give the Uttarasi during the Ritukala because it is apavruta. Garbhashya, Garbhasana. So Sukham Sneha we can attribute during that particular period. Interpretation, Artavakala is mentioned for achievement of the Garbhasnehana, consequently to conquer the Vata and regulate the Vata, and Vata is vital role to play in the Bija Kalpana. Masad Bijaya Kalpate, because of the action of the Vata, the Sukshma Kesha Nalika that are situated in the Garbhashaya getting Tarpana, Pura Yanti, Tarpa Yanti, by the help of Vata. So we want to regulate the Vata here and consequently, of course, to achieve the Garbha. So why during Artavakala? It is Apagata. So I explained in previous slide. So this is just the replica of that slide. So that means devoid of functional layer of the endometrium there. So you are directly helping there the appropriate development of the functional layer of the endometrium when you are doing that. So and in Yoni Vapor treatment, Uttarasi is mentioned there. Pratidoshantu Sadhyasu Snehadikramayishyate. इसके बाद करने का निर्देश है. So it is the first line of treatment in the Yoni Vapor. So you can see here the reference from Susruta Uttara, and consequently Acharya Dalhana also endorsed that Uttarasi to do, but Snehan Svedan करने के बाद करने के लिए निर्देश है. जैसे हम बाकी प्रोसीजर्स करते हैं. एंड रक्तगुल्म चिकित्सा में उत्तरासी का निर्देश है कि डोंट थिंक दैट रक्तगुल्म हो गया तो हमें वहां नहीं करना है. तो अक्सर हम मतलब वी थिंक दैट वी आर हेल्पलेस, वी आर डिवाइड ऑफ हेल्प फ्रॉम आवर सिस्टम, but that is there laid down all the principles in Ayurveda, but only thing is we have to understand, we have to bring into the practice. And Mutrashaya Gata Rakta Pitta, Uttarasi is indicated there, Mutra Kucha, Uttarasi is indicated there. अक्सर हम सोचते हैं कि बहुत सारे दवाई दे दिया chronic resistant UTI cases है तो वहाँ आपके पास रास्ता है. The thing is you have to open your mind for that. And in Pittaja Mutra Kucha, Uttarasi specifically mentioned there. So these are different, so many are there, but a few examples I have shown here. And coming to the Aushadha Yoga, what are the Aushadha Yoga? Sneha Dravya are suggested to use in majority of the conditions, and Sneha is also considered as suitable form of Uttarvasti by the Susupta. So Sneha Sara Ayam Purusha. Purusha is the Sneha Sara. So Sneha is the best thing to adopt for the Uttarvasti. Even the प्राणश्च स्नेह भूयिष्ठाः, प्राण जो है वो भी स्नेह भूयिष्ठा है, इसलिए और स्नेह साध्याश्च भवन्ति, जो बीमारी जो है वो स्नेह साध्या ज्यादा होते हैं. तो स्नेहो ही पाना अनुवासना, तो उसी क्रम में आप देख सकते हैं उत्तरावस्थी, मैंने रेड कलर में हाईलाइट कर दिया उत्तरावस्थी. बाकी नस्यकर्म वगैरह में भी, इसीलिए स्नेह इज द श्रेष्ठ ड्रग टू अडॉप्ट. In Niruvasti, we know that Kashaya, we have to use it. So what are the different drugs mentioned in Uttarasi? You all very well know, so I'm not going to throw much light on this. Like the Jivani Gana, Sadhita Tel का use करने के लिए दशमूल तेल का है, तो हम करते भी हैं. प्योर स्नेह है, सिविश तेल है. So coming to the effect of Uttarvasti. So this helps encourage the downward movement of the Vayu. So what are learned in the Samhitas? So Vasti Chikisa produces influence all over the body and tries to remove mainly the initiated Vata dosha and also Pitta Kapha dosha to some extent. So here also we can apply for the Uttarvasti also. So and anovulatory, sorry for the spelling mistake, anovulatory conditions can be effectively combated with the help of the Uttarvasti with the Falagruta, etc. Of course, drugs is your choice and your experience. You can use it. आपको जहां ब्रह्मांड चाहिए उस हिसाब से लेना है, जहां शोधन है उस हिसाब से तेल आपको सेलेक्ट करना पड़ेगा. So mechanism of action in Vata Jayoni Vyapa. So roughly when you compare it with the endometriosis, so here in endometriosis how Uttarvasti is helpful, let us see. So molecular mechanisms governing progesterone and estrogen signaling supporting endometrial function and how they become dysregulated in endometriosis. So एक review study हुआ था. So E2 induces epithelial proliferation to build endometrial thickness during the proliferative phase of the menstrual cycle, and then P4 inhibits the estradiol 2 induced proliferation and allows stromal cells to begin decidulation during the secretory phase. So this is the basic thing, okay? Epithelial proliferation and decidulation of the endometrium. So when the tightly regulated balance of these epithelial stromal P4 enzyme and E2 signaling is lost, then the P4 resistance and E2 dominance are prone to ensue, potentially leading to the uterine disease such as endometriosis. So this balance, probably my hypothesis is that we are regulating this balance, we are harmonizing the dialogue between these P4 and the E2 signaling, we can reverse the endometriosis. And the next condition is the Azimuth Syndrome. This is again a new indication. The people are thinking, they are searching for. So in modern side, so of course injury to the endometrium due to repeated etc. This is the pathogenesis there in the Azimuth Syndrome. So this fibrotic endometrium have menstrual abnormalities, especially amenorrhea. We know that. So impaired fertility manifesting etc. So here they are giving the allopathic counterparts. They are trying this PRP, platelet-rich plasma infusion can promote the tissue regeneration in patients with various clinical conditions, including the ulcers, burns, muscle damage, etc. So they extended this application to the Uttarvasti also. So they don't call it as Uttarvasti. Intrauterine, the installation of the plasma-rich, platelet-rich plasma in this small volume. So I extend it to the Uttarvasti. So in cases of the Azimuth Syndrome, we can apply with the Ksharataila in Azimuth Syndrome. So that is again a new indication as far as our system is concerned. And uterine fibroid, of course, many of us are practicing in the fibroid with the Ksharataila, Apamarga Ksharataila Uttarasti we are doing in these cases. And Palasakshara oil also can be used, and the trials are also going on, and some they have carried out also. So this is not very much new, the Lekano Taila Uttaravasti. And in cases of the low AMH cases, So we know that AMH is produced by the granular cells. So it is a potential marker for ovarian reserve. So how we can enhance this ovarian reserve? So a woman undergoing IVF with low AMH has a poor success rate. So this is the indication how the modern people develop testing the AMH. And the signs and symptoms of a patient with low AMH level can be compared to Dhatukshejanya Vandyatva. So Brahmana, Uttarasi can be given there. So in cases of the, not only this, in cases of the hypoplastic uterus, in such cases we can adapt this Brahmana kind of Uttarasi. So in this case, it was Uttarasi done, and consider this case as the Pushpanasa. So, and the value of AMH after the treatment was considerably improved on a much satisfactory level. So the option of egg donation can be discarded. So there is a more possibility with the Ayurvedic treatments in these cases, low AMH levels. So, and of course, this is very much documented tubal factor infertility, the tubal black. So there are so many studies done with the different thylas. Kumari thyla mentioned in Bhav Prakash done at, I believe it is Jamnagar study. And you may adapt the Kshirabala thyla, Bala thyla, even the Kshara thyla. If the case is tough, you can go for even the Kshara thyla. So there are so many options, but the indication we all know, it is very well established indication, right? So, and endometrial receptivity. So I think there is a study carried out, and they have particularly seen with the how the new cell regeneration from basal layer may be assumed by proper Vata function. They carried out with this object this study. Anjali Verma, probably she was the student of Kamini Madam, and they have published this study. So in this study, Bruce Shitavari Gupta, they have taken up, and they have seen the endometrial thickness and endometrial layering effect on the endometrial layering, and myometrial echogenicity, uterine artery Doppler flow, endometrial blood flow in zone 3. So, and myometrial blood flow also. So these are the parameters, and right. So here, uterine artery is normalized there. In this case, pulsatile index of the remaining results are also mentioned there. But still, I cannot go through all the minute details because of the time constraint. And the intrauterine infusion of penatile in males, a study carried out by, I believe this is outside India. So they have with the object to determine the effect of intrauterine infusion of penatile. So anyway, they don't have Kshiravalla, etc. So they have selected some oil. So penatile they have selected to see on the endometrial health. So 6 males aged 3 to 12 years old were used in a crossover design, with each male administered both 1 ml of intrauterine penatile and a same treatment on different estrus cycles. So the effect of intrauterine infusion of 1 ml penatile or sham treatment were measured using a interovulatory period, uterine fluid accumulation. So many markers they have adapted there, and biopsy scores and histological features also they have done. So intrauterine infusion of penatile in males, experimental study. So did not statistically prolong the luteal phase nor elevate salivatory cortisol levels, but did cause the superficial erosion of the endometrial surface epithelium in all males and significantly increased the eosinophil numbers in the endometrium. The Kenny grade of biopsies from 2 out of 6 males worsened transiently following the infusion. So the conclusion is intrauterine penatile does not statistically increase the duration of the luteal phase, but results in inflammatory response and increase in the endometrial eosinophil number, suggesting treatment may be associated with the hypersensitivity type of reaction. But this is their this thing. But what I want to establish here is they are also looking into this kind of treatments to give the intrauterine installation. And the other one is the intrauterine administration of plant oils in luteolysis in the male experimental. So this is again other study to determine effects of intrauterine administration of estrogen and various oils on cyclic luteolysis in the male. So the result is administration of fractioned coconut or peanut oil on day 10 post ovulation provides an effective and practical method of prolonging the luteal function. Pseudo pregnancy, thereby wherever it is necessary, they need maybe some other thing to prolong the luteal function. So thereby suppressing the unwanted estrous behavior. Further studies to elucidate the mechanism by which this is achieved may increase understanding of both luteolosis and MRP signaling in the male. So probably this we may adopt in cases of the where endometrial hyperplasia is there and the continuous estrogen effect is taking the endometrium. So in such cases we can help Uttarasi. And evaluation of therapeutic effects of 5-day intrauterine infusion of eucalyptus globulus oil solution on males with experimentally induced endometriosis and streptosis. So again, this is the intrauterine installation की बात कर रहे हैं यहाँ भी. So why I want to show this means the people are thinking, trying for intrauterine installation of with the different mediums to treat the endometriosis, etc. And one more thing is for the control of pain also they tried this oils, intrauterine installation of oils to relieve pain in endometriosis also. And flushing of fallopian tubes with the poppy seed oil, so they are trying. Probably they might have copied the Uttarasi. I don't say copied or not, but they gave a thought that we can do this. So they have there could be something in poppy seed oil that has a specific benefit, or it could just that oil is better than water at dissolving any debris or mucus in the tubes. That is their conclusion. So this is just a small support. That's all. Anyway, our treatment is established in the tubal bladder. And effectiveness on fertility outcome of tubal flushing with the different contrast media, systemic review on network meta-analysis. So again, tubal flushing की यहाँ बात कर रहे हैं. So they have done the review 283 study is identified through the search 14 RCTs reporting 3852 women with infertility were included. So uterine lavage, they also agreeing that indications and practical techniques. So to this lavage and the treatment of uterine infections is based upon the reduction of bacterial numbers and removal of exudate from the uterine lumen, enhance the physical clearance of uterine contents, recruitment of neutrophils and possibly opsonins by inducing transient. Means इनका कहने का ये मतलब है even the infections you can use the uterine lavage. So Uttarasi we can do lavage. You may use the kashaya or you may use the oil. So nowadays here we are trying in an area that even the hydrosalpinx we are starting giving the Uttarasi. So that is also yielding result in cases of the huge hydrosalpinx cases. So well, and Uttarasi and ovarian factor related infertility. This is from Dr. Bhagesh report. This study, Setapushpa Tela and Shetavari Tela Uttarasi, they have carried out using the of course containing the phytoestrogen, etc. Group A and B, 30 in each group, and Setapushpa Uttarasi with the herbal compound. The Setapushpa Tela Uttarasi is again another compound. So they showed timely induction of the ovulation here. So Uttarasi is established even for the ovulation. So anyway, these SOPs, very well that preoperative what we have to administer. So similar to another or other procedures, we have to carry out with the consent taking and autoclaving and all those in the instruments, etc., etc. But the one thing typical is we have to administer the Anuvasana and Niruhavasi prior the Uttarasi in order to obtain the best result. Okay, or 3 Niruhavasi also you can follow. And the written consent should be taken. Of course, these you know very well. I can skip. And the instruments we know very well. What are the instruments we have to use? Like other similar procedures we have to. And previously we used to give the IUA cannula. I mean the nasogastric tube, etc. But now you can use the IUA cannula. Very much disposable IUA sterile cannula is available. We are also using the same IUA cannula to give the Uttarasi there. And of course, these are the different measurements mentioned for the Pushpanetra and Vasti Putaka, etc. are there. And but this is not applicable to the intrauterine installation. So we can use the instruments available nowadays. So this is the reference for the Anvasana Uttarasi Chikitsa. And this is the procedure. And the time we know, I mentioned previously, and procedure. So you can have a look at it. So Urdhva Janvo, Sriyo, Dadyat Uttanaye Vichakshanaye. Right? So Uttanaya Sainaha is the position suggested for that procedure. You know very well. So this I can skip. And coming to the dose, intrauterine installation, since the volume of the uterus is 1.7 in nullipara, so you can limit your this thing is 2.5 ml and in paras women 5 ml. So in addition to that, to fill the IU cannula, you have to take 0.5 to 1 ml. So your total quantity is coming to, scientifically when you analyze, then total quantity is coming to 5 to 7 ml. So in case of tubal black, distal black is there, so you can enhance the oil quantity to 7 to 10 ml. So approximate pressure required in syringe is the 150 to 190 mm of Hg, and the drops per minute, 5 ml oil requires 1 minute to 25 seconds. Practically we have studied this. So 150 drops are going within 1 minute to 25 seconds. So coming to the temperature, we instill lukewarm oil. So according to the Prakriti, you can set the temperature. Oil must be instilled in a gradated manner. Don't be in hurry to push the oil inside the uterine cavity, right? So how oil is inserted, you can see here, and how oil is reaching the tubes also. You can see, followed by pichu, you have to apply, and volume of the uterus supporting all this, and the precautions continuing. Syringe along with the cannula should be made free before taking oil inside, and whatever the gruta or oil, so make it air bubbles free, and then instill the oil. And the complications, you have to check it by the Vastidata, and important thing is vasovagal syncope. So you must be capable, because this procedure is capable to cause the vasovagal syncope. So forcefully don't do anything there. So it is a common autonomic reflex involving the cardiovascular system. It is associated with the bradycardia, hypotension, likely mediated by parasympathetic activation and sympathetic inhibition. So it is not usually life-threatening. You can manage it. So tilting of table can be done immediately to prevent it. That we do, and everybody is practicing. That is a practice. So tilt testing may be helpful, prevent heart rate and blood pressure response that occurs spontaneously. So how the parasympathetic system is governed means different this visceral organs, how it is governing. So that is here you can see some the splanchnic, pelvic splanchnic nerves are supplying here to the uterus also, even the bladder. So there is a possibility of the vasovagal syncope. So you always keep in mind when you are doing the procedure, right? So you are governing all these nerves that are innervating the pelvic structures. So advice, avoid sexual intercourse during Uttarasi, force, avoid heavy work, exercise, continuous standing position, cold substances, heavy meals, etc. And to take Patekara Ahara. So these are the general advice. So many research also done. Shilpa madam, I think I can take some more time.
Yes, ma'am. Yes, please continue.
Okay, yeah. Thank you.
Yes, you can, ma'am.
Yeah, thank you. Uttarasi in Budavarta, primary dysmenorrhea is studied. So Krishnartha, when we see in the indications, but we don't give so much of attention. So in primary dysmenorrhea, Uttarasi, Mutra Marga, you can do there, right? So a study also carried out. Control with the menstrual spans and the Uttarasi with the for 3 menstrual cycles for 3 days from starting from the 9th day onwards. So this was a RCT study, randomized control study. So control group felt symptomatic relief only, but in Uttarasi group, anti-inflammatory probably the drug used was the lesser, so anti-inflammatory action might have also helped. The author would like to say like this. And amenogenic property was also there, so probably the patient has got good result in case of the Uttarasi group. And study to another study with the Falagruta on 30 number of female infertility cases they have done for the 3 consecutive cycles, and overall encouraging results were observed in this Uttarasi cases in the female infertility. So the different factors also shown here: uterine, cervical, tubal, ovulatory, unexplained. All these were taken up for the Uttarasi in incorporating primary as well as secondary infertility patients. So one ovulatory patient got conceived and the tubal 06 patients got conceived. Sample size was so less in this study. And study 3, development of standard parameters for Uttarasi and evidence-based trial. This is tubal black done with the Kshirbala Thaila Uttarasi. Intrauterine installation 10 ml for 3 sittings on 9th, 11th and 13th day for 3 cycles. And HSC, confirmed on HSC, maybe unilateral or bilateral were taken up. And almost complete removal black seen in 30% of cases and partial removal 21. So altogether, near about 50% results were achieved in this study. And in fibroid, 2 fibroids, this is the Nityavirachana and internally concentrated flower given, but Apamarga Ksharathaila Uttarasi was done, and followed by Apamarga Ksharathaila Ionipichu was also administered once in a week. So this also fibroid, 1 fibroid disappeared and 1 shrunk to means 32 to 32 to 34 mm. So this was very old, the case reporting patient. And combined effect of Lasnadi Pana and Lashna Thaila Uttarasi in anovulation due to PCOS. Sample size was 15. Anovulation was the condition due to PCOS, and Lashnagruta was administered here. The result showed that Lashnagruta Pana along with Lashna Thaila Uttarasi is effective in ovulation and also to increase the size of the follicles and in regularizing the menstrual cycle. So in the previous slide I have shown the anovulation is also Uttarasi is effective. So whatever the factor related to the infertility, in all those factors you can do the Uttarasi, and of course other indications also I have shown there. And Ksharathaila Uttarasi in the management of fallopian tubal black. So the medium and the different kinds of thaila are using, but the Uttarasi is same in cases of the fallopian tubal black. So here, so sample size was 19 were taken here, incorporating both unilateral and bilateral tubal blackage. Ksharathaila 5 ml intrauterine installation was given for 6 days. With the interval of 3 days in between after completion of the menstrual cycle. For 2 consecutive cycles they have given. So tubal patency was found in 68.75. So around 70% they have got achieved results in this Ksharathaila Uttarasi. And another study on the Arthavakshaya. So I said that even the endometrial factors. So Arthavakshaya is more of pathology related to the endometrial regeneration. So here also the Krishna Thaila and Arthapushpa Thaila Uttarasi was done. And under 3 groups, Uttarasi 1 group and oral administration of Krishna Thaila Quata and placebo. So this study they have carried out. Sorry, I missed the result here. But I believe, whatever I remember, that Uttarasi with the Krishna Thaila group was shown much better result here. And Uttarasi with Dhanvantari Thaila in female infertility. So this is again the PCOD group, tubal obstruction, anovulation and menstrual abnormalities. And at 4 groups the study carried out. So here the sample size is also good. You can see 30, 30, 20 and 20 patients they have taken under 4 groups. So the drug is Dhanvantari Thaila. So all the patients were given Uttarasi with Dhanvantari Thaila after giving Sneha Svedana Sodhana Vasti consecutively. 5th day of menstrual cycle after cessation of bleeding in the consequence of Sneha Vasti followed by Sodhana Vasti and then Uttarasi for 5 days. So the treatment was repeated in the next cycle also for after cessation of the bleeding and continued for 3 cycles. So overall conception rate was 75%. So this is establishing, the study is establishing that it may be the PCOD, anovulation, tubal black, whatever. So highly significant study they have reported in PCOD and tubal black, but the study still shown effect in anovulation and menstrual irregularities also. That's what the study stated, that statistically the result was significant in all 4 groups. So, and a clinical study on the management of Vandirpa due to anovulatory cycle with the Mahanarayan Thaila, Nasya and Uttarasi. Mahanarayan Thaila for Nasya and Uttarasi, 33 sample patients they have selected, having anovulatory factor being diagnosed by the transvaginal sonography for 2 consecutive cycles. So, group A for Nasya, group B for Uttarasi, and group C placebo control. So, group A, 8 drops of Mahanarayan Thaila, Nasya was administered, and group B 5 ml Mahanarayan Thaila, Uttarasi, and group C placebo capsule oral was given. So result you can see here in the downline. I have mentioned that ovulation occurred in Nasya 60C and ovulation occurred in Uttarasi 28 and 25% ovulation in control group. So here Nasya is established, but still Uttarasi is also working. So when you join together these two, I think you can achieve 100% result in case of the anovulation in certain cases. So even for the pain relief, modern people are using this. So topical, as a topical anesthesia, intrauterine installation of topical anesthetics they are using. So a study carried out. This is again randomized double-blind placebo control trial. So in the OBG department, Faculty of Medicine, Turgut Özal University, Turkey. So the aim of study is intrauterine levobupivacaine वर्सेस लिडोकेन, मतलब दोनों एनेस्थेटिक को और प्लासिबो के साथ उन्होंने टेस्ट किया whether the pain control is achieving or not. So on the intrauterine installation. So this again the new scope for the Uttarasi and therapeutic aversion by intrauterine installation of prostaglandins. So we can also try for this therapeutic aversion also with the Uttarasi with the drugs that are having uterine evacuation property, Sodhana property, like the Kushta Thaila or something like that, Madanphala added Thaila. We can take a trial in cases of the therapeutic aversion, but still we are not permitted to use in these cases. So people are they can have a extraordinary permission and they can go ahead for the therapeutic aversion trials. So well, I have discussed already promotion of endometrial proliferation and intrauterine installation of the different factors they are trying. See, granulocyte colony stimulating factor they are trying to give intrauterine installation to promote the endometrial proliferation. So they found enhanced endometrial development resulted in an acceptable pregnancy rate also. So this is the new scope for them, but this is old scope for us that is lying within our Samhita Sutras. With this, I hope you might have understood the new indications for the Uttarasi, what we can take up in the contemporary conditions. There are new demands for you, so you can cater through the Uttarasi. So thank you all for listening me patiently.
Thank you, madam. Thank you very much. It was really nice, something new. So yes, ma'am. Thank you very much. Question answer session. Yes, doctors, you can ask your query. Yes, please. You can unmute yourself and ask directly, please. Ma'am, I just want to know what is this actually? Lavage and all such things are there. It is different from Uttarasi. Is it different?
Just like how gastric lavage they are performing, they are trying there. So what I mean to say here is, so in that cases also, why don't we use the intrauterine installations? Okay, we may not go for the lavage of the uterine cavity, but we can use there also the intrauterine installation of Kashaya or the Thaila. I mean to say that.
In which diseases, ma'am? कौन से disease में हम इसको follow करेंगे?
हाँ, तो जैसे कभी मतलब द प्रोडक्ट्स ऑफ कंसेप्शन रिमेन होकर के इन्फेक्शन हो जाता है consequently. In that cases, or in cases of the endometritis, pyosalpinx, pyometra, in those cases we can still we can keep it as a new hope. The
The
lavage
same
of uterine cavity.
the same other things are same like Uttarbasti, like indications and all the procedure.
Yes. The only media we are choosing as a like the Tripla Kashaya or something like that. The oil that can act as an anti-inflammatory and antibiotic जिसकी कैरेक्टर है, तो ऐसे ऑयल हम यूज कर सकते हैं.
Okay. Yes. Yes. Anyone? Mute. आप unmute करके डायरेक्ट पूछ सकते हैं प्लीज. डॉक्टर सीमा जी नमस्कार. तृप्ति, डॉक्टर वैशाली, डॉक्टर हेतल जी, डॉक्टर कुसुम, डॉक्टर शशि मैम नमस्कार.
Excuse me, ma'am.
मैडम नमस्ते.
Yes,
दीदी
yes.
नमस्ते.
Namaste, ma'am. In case of yoni branch, if साथ में सिस्टोसिल भी है और रेक्टोसिल भी है, तो उत्तरवस्ती दे सकते हैं क्या मैम?
हाँ, उत्तरवस्ती दे सकते हैं. यू कैन सेलेक्ट उदुम्बरा समथिंग लाइक दैट. आपकी जो इंडिकेटेड है आप ले सकते हो, बट उत्तरवस्ती दे सकते हैं. तो शास्त्र में भी लिख दिया ना योनि ब्रह्मशोष है ना.
हाँ जी मैम. थैंक यू मैम.
Yes, डॉक्टर कुसुम.
मैम अगर किसी पेशेंट को उत्तरवस्ती अगर प्लान करना है तो पहले उसका माने एमसी के 5th डे से कुछ देना है, फिर उसको 8th डे में उत्तरवस्ती स्टार्ट करना है क्या? पहले उसको कुछ 3 दिन देना पड़ेगा?
हाँ, मतलब एक्चुअली अनुवासन अवस्थापन करके देने से आपको मतलब पूरा जो थेराप्यूटिक एफिकेसी वो अचीव कर पाएंगे. बट इट डिपेंड्स ऑन द इंडिकेशन, मतलब आप किस लिए करना चाह रहे हैं उस हिसाब से आपको अर्ली स्टार्ट करना पड़ेगा. आपको एंडोमेट्रियल प्रोलिफरेशन अच्छे से करना है, वो साइड डेवलपमेंट होना है, फॉलिकुलोजेनेसिस अच्छे से आना है, तो आप 5th डे से स्टार्ट करना. अदरवाइज आप सिर्फ ओवुलेशन इंड्यूस करना चाह रहे हैं या इम्प्लांटेशन कैपेसिटी बढ़ाना चाह रहे हैं, तो ये देन यू कैन स्टार्ट ऑन द 9th डे.
जी थैंक यू मैम. मैम एक पेशेंट है, उसका फॉलिकुलर स्टडी में था कि ओवम फॉलिकल बन के रप्चर नहीं हो रहा है, तो रप्चर होने के लिए भी क्या उत्तरवस्ती इफेक्टिव है?
रप्चर होने के लिए मेरे इसमें तो है ही नहीं. मैं तो सिंपल मतलब गंधर्व सादी तैल ऐसा हम लोग यूज करते हैं. वहाँ सिंपल सत्य विरेचना फॉर्म में देते हैं, तो वो हम रिलीज हो जाते हैं. तो उसके लिए आप उत्तरवस्ती तक जाने की जरूरत नहीं पड़ेगी.
थैंक यू मैम.
या वेलकम.
क्षार तेल यूज करने के लिए कुछ स्पेशल इंडिकेशंस है लाइक उत्तरवस्ती के लिए?
हाँ मैडम, जहाँ मतलब फाइब्रस टिश्यू हमको लग रहा है, जैसे एशरमैन सिंड्रोम है, फाइब्राइड यूट्रस है, एडिनोमायोसिस है और इवन हाइड्रोसाल्पिंग्स है, तो ऐसे केसेस में क्षार तेल इंडिकेटेड है.
अच्छा मैम, और एक लाइक ना गर्भिणी अवस्था में तो हम लोग नहीं देते हैं उत्तरवस्ती, फिर भी कुछ इंडिकेशंस है क्या स्पेशल केसेस में?
नहीं है.
बिल्कुल भी नहीं देना है.
नहीं देना है.
ओके. और ये भी थोड़ा सा मुझे जानना था कि 8वें महीने में जो आचार्य बताते हैं ना कि सुख प्रसव के लिए बस्ती दी जाती है, तो इसके लिए क्या कुछ अलग से इंडिकेशंस होंगे?
अनुवासन अवस्थापन की इंडिकेशन है. प्रेगनेंसी वो जो 8th मंथ 9th मंथ वाली जो है, वो तो मात्रावस्थी यूजुअली प्रैक्टिस करते हैं. हम तो निरूहावस्थी पास में जब आएगा तभी हम निरूहावस्थी का सोचते हैं, तब तक तो मात्रावस्थी में ही डिपेंड होते हैं. जैसे हमको शो वगैरह दिखे कि पेशेंट इज इन लेबर, तब हम आगमेंट कर देते हैं उत्तरवस्थी सॉरी निरूहावस्थी से दशमूल वगैरह. बाकी तो मात्रावस्थी में ही डिपेंड होते हैं. 8th मंथ
डोज सेम रहेगा, जैसे नॉर्मल अवस्था में जितना देते हैं उतना ही देना है गर्भिणी में भी?
तो वो देखना है पेशेंट की जो मेजरमेंट है, मतलब उस हिसाब से आपको तय करना होगा. आपको 30 ml देना है, 40, 50, 60, जितना देना है आप डिसाइड कर सकते हैं बेस्ड ऑन द मेजरमेंट्स ऑफ द बॉडी डायमेंशंस के हिसाब से आप कर सकते हैं। बाकी कॉन्ट्राइंडिकेशंस कुछ है क्या पेशेंट के साथ वो देखना पड़ेगा। हाइपरटेंसिव ऐसा केसेस है तो आपको सीमित रखना पड़ेगा डोज।
अच्छा, और मैम इन केस अगर कोई कॉम्प्लिकेशंस आते हैं उत्तरबस्ती में तो इसको हम लोग आयुर्वेद में कैसे हैंडल करेंगे, मतलब कुछ कभी चक्कर या
हाँ वो तो हम अपने पास लेने में तो हमें अमृतोष वगैरह मिलता है, जैसे जो मतलब अपना वो जो रिहाइड्रेशन फ्लूइड जैसे हमारा अमृतोष काम करता है जिसमें यवक्षार वगैरह ही डाला हुआ है वो हम दे देते हैं इधर तुरंत। और बाकी रिटेंशन ऐसा कुछ लगता है तो आप योनिशोधन वर्ती लगा सकते हैं वापस लाने के लिए। यूजुअली हम तो आयुर्वेदिक इसमें ही मैनेज करते हैं। वेरी रेयरली जो वैसा वैगल कभी एक आधा केस बहुत लंबे समय में एक देखा हमने। ऐसे कुछ में तो फिर एलोपैथिक इमरजेंसी मैनेजमेंट में जाना पड़ेगा।
बिल्कुल डेफिनेटली। यस यस मैम यस। और किसी को कुछ सवाल या कुछ क्वेश्चंस डाउट्स है तो प्लीज। ओके आई थिंक अभी तो कुछ ये नहीं दिख रहे क्वेश्चंस, तो मैम आज के लिए रुके हम लोग।
हाँ जी
यस डॉक्टर शशि आर यू देयर? डॉक्टर शशि, डॉक्टर शशि मैम आर यू देयर? डॉक्टर शशि शर्मा। ओके डॉक्टर वैशाली आप कर दीजिएगा आभार प्रदर्शन। डॉक्टर वैशाली बालवंडे जी, बहुत अच्छा लगा मैम। अच्छा मतलब पूरा कुछ नया भी था आपने जो ये बताया ना लैवेज वगैरह, ये तो नया ही था हमारे लिए। सो थैंक यू वेरी मच।
थैंक यू वेरी मच मैम, बहुत अच्छे से समझाया आपने रिसर्च और सब कुछ, मतलब प्रैक्टिकल नॉलेज और मतलब कंपैरिजन करके वगैरह बहुत अच्छे से समझाया। मतलब अभी हम उत्तर बस्ती करते हैं प्रैक्टिस में, लेकिन अभी ज्यादा कॉन्फिडेंटली करेंगे और बताएंगे भी कि कितना अच्छे से मतलब रिजल्ट मिलता है। थैंक यू वेरी मच मैम।
थैंक यू डॉक्टर वैशाली।
यस मैम थैंक यू वेरी मच। आभार आयुष दर्पण की तरफ से भी मैं आपका आभार व्यक्त करती हूँ, और सभी वैद्य पार्टिसिपेंट जो भी सारे वैद्य यहाँ पर उपस्थित हैं और जो भी सारे दर्शक फेसबुक पर भी इसको देख रहे हैं, तो बहुत बहुत आभार आप सभी का। और ये जैसे आज का ये सेशन है वैसे ही रोज हमारे यहाँ ये आयुर्वेद क्लिनिकल गायनेकोलॉजी संभाषा चलती है पिछले कुछ महीनों से, तो आप भी इस परिचर्चा में अपना सहभाग ले सकते हैं। आपके केसेस, आपके जो भी क्वेश्चंस है प्रैक्टिस से जुड़े, वो भी आप यहाँ पर अपने अनुभव के रूप में शेयर कर सकते हैं, या कुछ केस स्टडीज वगैरह भी आप यहाँ पर शेयर कर सकते हैं। तो जुड़ने के लिए संपर्क कीजिएगा 9410379397 पर। तो आभार सभी का और नमस्कार सभी को। थैंक यू मैम।
थैंक यू मैम।
ओके मैडम, थैंक यू एवरीवन।
थैंक यू मैम।